Hi everyone, welcome to Advanced Pharmacology 511. I am just going to quickly go over the course. So there's a course wall which we'll look at in a minute. The course overview. So this is graduate level pharmacology. So you're not just we're taking this a step further from your undergraduate. You're going to develop advanced knowledge of pharmacology and pharmacologic responses. So looking at how the medication works in the body, how the body absorbs medication, and how we process the medication, as well as cultural, social, genetic, and other issues that impact patient decisions regarding pharmacologic treatment. And the genetic aspect is actually really quite important to understand. We are also going to discuss herbal and alternative therapies. And we are also going to hit on disaster emergency management. So here are the course goals. So you're going to be able to analyze pharmacologic properties throughout a broad category of drugs. And something I want you to understand, and I'm really excited that we're using this book. Let me pull it up. Okay. Pharmacology for nurses, looking at it from a pathophysiologic approach. Really important that you understand the basic physiology of the body, because that's also going to help you understand how medications work. Now, I prescribe medications on a daily basis, and I will tell you that understanding pathophysiology and pharmacology go hand in hand, and if you just kind of not overthink things, you're going to do very well with pharmacology. So what's important is to analyze the relationship between pharmacologic agents and the physiologic response. Describe motivations of patients in seeking prescriptions and their willingness to adhere to prescribed regimens. So side effects do make a difference. Dosing does make a difference. Price makes a difference. You want to determine the impact of herbal and alternative therapies on disease states and pharmacologic treatments. Safely and appropriately selecting pharmacologic agents for the management of patient health problems. And this is going to be based on their variation, so their age, their genetic components is really important to remember. What problems are being managed and cost effectiveness. Applying and integrating organizational, client-centered, and culturally appropriate concepts in planning, delivering, management, and evaluation, medication administration, and evaluating the role of the nurse in collaborating, consulting, communicating with other healthcare professionals to manage and coordinate medication distribution during times of medication shortage. So, this is the other book we're using, which is Disaster Nursing and Emergency Preparedness, and this is really important, especially in this day and age. So, the first module, we are going to talk about contemporary issues in pharmacology, and as you move down, we're going to talk about different aspects throughout the body and how we prescribe medication to deliver them. I am really excited to go over all of this with you. So, of course, we have our discussion boards, and I want to show you how to get to your rubric, because the rubric is the breakdown of how we grade things, and I do grade based on the rubric. So, discussion board rubric is right here, and so critical thinking. Was it rich in content, full of thought, insight, and analysis? So did you break down the concepts instead of just covering them and talking about them generally? Did you apply it to the clinical setting? Did you look at research to support your arguments? And that's where logic and argument come. Content, obviously, you're hitting all aspects and using relevant content. So are you getting resources that are within the last 5 years. And then your style, APA, grammatical, I do look at that. This is a graduate level course, so I do expect that to be pretty innate in your writing. And then when your responses, they do need to be in depth. They cannot, you're not going to get much credit if it's very general, like, oh, I agree with your post, or thanks for this post. It's a discussion. So I would like you to drive the discussion forward with your discussion responses. And then each week you are going to have assignments, and the rubric is also there too. And the assignments are broken down here. And this is really going to show me how you understand the work. So if you have any questions, I'm so sorry guys, I have a little bit of a cold, so my voice is weak. My contact information is actually here on the wall, which is right here. Here are the due dates of everything, and here are the classroom policies and rules. And I also have some good writing tips here, and then right above that is how to avoid plagiarism. A lot of people tend to struggle with paraphrasing. I know you guys are graduate students, but this is for my undergraduate classes, but some graduate students still struggle with this, so I want you to look at it just to make sure you don't paraphrase incorrectly, because it results in plagiarism, and I don't want you guys to miss points or fail a class because of that. So I look forward to working with you. If you have any questions, feel free to contact me.